everyone. This is Kim, final module. Okay. So I'm sure people will be joining us. I just reminder email to everyone to join us, but I know that there have been people following us watching the recording after live session. So I just wanted to cover some details about certificate of completion for this course. We're interested in receiving this certificate, and basically extended the deadline to December 13th, Friday, December 13th, for and all of the required documents for receiving a certificate. People have already handed in assignment 2. A description went out last week, and by the end of this week, we'll have a final quiz will be completed online and be emailed out by the end of this week, also on December 13th. And then all of those will have an online feedback form for everyone to get feedback on this course, because as you may know, this was a pilot course. This is the first time we've ever done it. So we had a huge amount of interest. We've got to make sure that still gives towards the audience that really would benefit the most from it. So please fill out that feedback form when you receive it in the next couple of weeks. So I do have some brief comments about assignment 2. As options, there was doing a case study, demonstrating a collaboration between WASH and NTD sectors, and also the option of doing an interview with a government official in the country where you're working, or if a person from an NTD NGO as a WASH practitioner could have a conversation about potential synergies and potential areas for collaboration. So basically the case study was to understand what worked or didn't work, and the interview was to understand how a relationship might be able to be built between these two thirds. Generally, since I could tell that people put a lot of time and effort into that, but very rarely was there examples of WASH and NTD collaboration or reviews where WASH and NTDs were discussed. Generally, people focus on WASH or on NTDs, which is strange to see, considering the whole point of this course is to try and discuss and try and push towards collaboration and overlap of these two sectors. But with assignment 3, we have to see of your thoughtfulness and your creativity and your knowledge that you've gained from this course. So a proposal where we get people to material from this course to their personal experience and whether an idea, a specific idea of how of NTD and WASH collaboration can work in their context. So looking forward to assignment 3. We hope that you put some time and effort into this. So we also have speakers for today. Lisa Schechtman is from WaterAid America. She's the Director of Policy and Advocacy. We're really excited to have her here with us today. Development and implementation of U.S. government policy and advocacy strategy related to water and to WASH, and advocates multiple agencies and the U.S. Congress. These areas include liaisons between WASH and maternal and child health, nutrition, gender equality, and poverty reduction. Lectures in international human rights and global health affairs from the University of Denver, and so has a degree in English literature and French language from Northwestern University, and is based here in the U.S. in Washington, D.C. So we're glad to have her with us today. She will be speaking with us first, and Yael Velleman is also joining us from the UK. She is with WaterAid, but a senior policy analyst for health and sanitation. And we're very excited that she'll be sharing her thoughts and her experience with us today. Her experience is global policy and advocacy on the role of water, sanitation, and hygiene in human health and development. She got her master's in health policy and planning and financing from the London School of Hygiene and Tropical Medicine, and her bachelor's in development studies. So excited for both of these well-experienced people to be with us today. And thank you very much for joining us, and we hope everyone is excited that this is the final module, and we look forward to questions and comments at the end. So I'll pass it over to
everyone, or afternoon where most of you are. Hope that you can hear me. Please feel free to type in the chat box if you can't. Just to give you a quick set of ground rules, I think this is consistent with the way that you all have done this in the past. If you have a very urgent question of clarification, or if you're confused about anything that Yael or I are saying, feel free to type your question in the chat box, and one of us is not presenting, we'll try to respond to you, or that we don't miss your question. And then we're hopeful that we've left plenty of time at the end for a more broad discussion that everyone can get into. So hopefully that's good, and we'll just get going so that we can get to the content. We operate under the assumption that everyone can be an advocate, but it's our understanding that the majority of the participants here are focused primarily on programmatic work. And so what we want to do is actually start by giving you a sense of how we think about advocacy, and then go into the meat of how we think about that links WASH and NTDs. So just to start out, it's a common question, advocacy. And the next common question is usually, can an organization do advocacy? Especially organizations that are not focused on advocacy, but instead are focused on delivering services. So of our conversation, the big question, which I think you all hopefully don't need to be convinced on, is about why we would do integrated multi-sectoral advocacy like WASH and NTDs. A quick kind of guideline that we tend to use about how to do advocacy planning. We would be helpful to go over some of the steps, some of the processes, because this is something new that we're all trying together, and we need to be sure that everyone felt that this topic actually is for you, as well as for those of us who have forward advocacy in our job titles. So a sketch of kind of advocacy strategy plan that I've used in the past. And see, the first step is to define your objective. This is really about ask what you want to change. What is it that's not working? Is it something specific about integration of WASH and NTDs at the program level? Is it even more specific than that? For example, it's about promoting with a specific population, or is it about government ministries not talking to each other so that there's barriers created? So once you find your objective, you figure out what is it specifically that would have to change in order for an outcome to be different and to be the way that you want it to be. Those outcomes would be about programs that are being done in communities, in the places that we're all working and trying to increase integration. So it's a good way to think about what's not working and kind of work backwards from there. That second point, which is target. Once you know the change that you need, then you probably can tell who can make the change. but it's important to identify stakeholders as well as potential partners, but the stakeholders in particular are really closely linked to your target. And that's because oftentimes the person who's most influential isn't the immediate target. For example, if you need the health minister to make a change, finding the advisor that they trust most on promotion may be your most important step. And so there can be a bit of norming, really, to figure out who actually has the influence and which partners you need to make sure that your influencer and your targets are most likely to listen. So who do they have relationships with? Who are most, what topics are they most interested in? And what linkages can you make to ensure that those influencers are most likely to participate in your advocacy work? We're into the fourth step about creating messages and key advocacy points. So I'll have standard messages that we use, whether it's working with community leaders to try and help develop a program, or, in my case, working with the administrator of USAID to influence the guidance and the priorities that the U.S. government is putting forward in this regard. When integrated advocacy, we have to adjust our standard messaging points, make sure that they're specific to our change objectives, specific to the thing that isn't working, but specific to our audience. And one of the challenges about doing integrated advocacy is that we're often working with audiences. For example, I've not worked a lot with anybody who's an expert in NTD policy, but if I'm going to be a successful advocate on WASH and NTDs, I have to figure out who those people are and what makes them respond. Here is about mapping out opportunities. So our coming, political events, hook days like World Toilet Day, anything like that provide you with a place to peg your advocacy and really start upping it after you've done all of it. An example of a successful integrated health project that I worked on in a previous life. It was focused on the integration of reproductive health and HIV, and it was advocacy, multi-country, multi-stakeholder advocacy campaign targeting the goal to fight AIDS, tuberculosis area, and a whole broad set of stakeholders around that. So to increase reproductive health integration with HIV prevention proposals that were submitted to the Global Fund to fight AIDS, tuberculosis, and malaria. This was because we had a strong evidence base around it. We knew that it was good practice in terms of what we would be seeing in clinics around the world, but we knew that it wasn't happening. Hopefully that resonates as a parallel to WASH and NTD work as well. It's something that we know there's evidence for and we know isn't quite happening the way we like in the end. We had 3 targets. The first was the Secretariat of the Global Fund. They were responsible for setting overarching policy. So they're responsible for disseminating messages that reproductive health interventions were supported by the Global Fund. Responsible for putting forward what was called a gender equality strategy, emphasized, interventions advanced the health of women and girls, which included reproductive health. So we focused on the Global Fund Secretary to make sure their policies were supportive of this work. We had to focus on country coordinating mechanism, which is the body responsible for putting forward Global Fund proposals. I think probably some of your organizations are members of your country's CCMs. Those folks that decide what the proposal will include. And so those folks require a lot of advocacy when we want them to try something new. Local NGO partners and came into play. We and the International Steering Committee of 6 international NGOs, 3 represented sexual and reproductive health, and 3 of which represented HIV. And together, those 3 organizations established a whole set of partnerships in the 10 countries that we were working in. In those countries were identified by our direct offices. So, for example, the International Planned Parenthood started member associations, and or the International HIV/AIDS Alliance member associations, etc. So there was a ripple effect of local partners buying local partners whose voices were particularly influential with the coordinating mechanism, and who either were allies in our effort or needed advocacy themselves to see the value of the work that we were doing and to participate in the advocacy efforts. The second to last point there about messages, this is an interesting one because we really had a really good global policy environment in place. The Global Fund actually promoted and allowed a lot of sexual and reproductive health rights services, but no new. And people were terrified to have a proposal rejected if they submitted it, including some of these reproductive health services. So a lot of our messaging was actually educating people on existing policy. And that's the case in some countries around joint NTD WASH work. There are, in fact, to be really good policies that people know about or that yet being implemented. So having about what is already on offer in the political and policy environment that you're working in, and what are the benefits of either implementing it or doing more and making change to the policies that exist. Our outcome was fantastic. We focused on rounds 7 and 8 of Global Fund proposals, so it was 2007 and 2008. In 2007, the first ever integrated reproductive health and HIV prevention proposal was approved. Over the 2 years, 8 out of our 10 partner countries were able to convince their governments to submit integrated proposals. And about 2/3 of those did receive funding for that integration in the end. So from a standpoint, it was a huge success, but it's also a huge, an important example of multiple advocacy that a lot of moving parts, very complicated, and a lot of collaboration around the world, but at the end of the day, it really paid off. I'm going to start to wrap up the intro and turn it over to Yael in a minute. Just to say, from one perspective, we're interested in NTD WASH advocacy, and there's huge possible list that we could have pulled together. We did with these, focused on the improved health and well-being of the populations that we're working with. That's really why we're doing this in the first place, and the evidence around the role that WASH can play in helping prevent NTDs is so compelling that it's just not an integrated approach that we feel we can responsibly ignore. So just flag that for WaterAid, influencing policy and practice is a really important part of how we work. We don't pull the two pieces apart. And so for us to recognize that innovation often requires an enabling environment set by government means that looking for those that really need a push is important. And we feel that this is one that could really benefit from an extra push, and that our, as advocates and implementers, can help to kind of bridge gaps, and we're really excited to find ways to do that with all of you. Yael, I think, is going to mention an example, a specific example that we worked on in Tanzania around the development of the net policy on the elimination of NTDs. But I want to make sure that I mention that working with the government can be tricky, and it's tricky in some ways when we're talking WASH, because water, sanitation, and hygiene don't always reside under the same government ministries, and sometimes they're almost orphans. In other words, they don't even have a clear assent related to WASH, and WASH can sort of be everybody's job, making it nobody's job. So we need to figure out ways that we can help bridge those gaps as we work together, to recognize that there need to be partners with the government, and sometimes that we need to convene the government. We have already done a lot more than many governments in integrated work by having this course, by having this conversation together. And so of the integrated advocacy work is to kind of assert that and to push it forward when we have the opportunity. Like I said, our ultimate objective for WASH, and I think for many WASH-focused partners, is to increase resources and ensure that WASH is a central package of interventions for better health, and look forward to doing that with you all to make sure we know what your objectives are and that we can find mutually beneficial ones and do some planning together. So take it over to Yael, and she's going to take the rest of it forward.
Hi, everyone. I hope you can hear me as well, and thanks for taking the time today to join us for this course. Thanks for this great presentation, and I think that gives us the foundation that we need to go into examples of where collaboration has worked in the past, but more importantly, what is it about the success stories around integration that worked? What is it that made the collaboration possible? What made the advocacy successful in this case? So move into a couple of concrete examples. I wanted to start by giving us a picture of where we are at the moment in terms of the change agenda around WASH NTDs that we have globally. There are a couple of ways that we can use to look at where we are at the moment. From perspective, having worked in the WASH sector for several years, I noticed quite a change in the level of conversation between WASH and NTD actors on the global stage over the last couple of years. What does that look like? Element is academic collaboration. We're seeing quite a lot of new research being undertaken about this link between WASH and NTDs. Studies that have been undertaken by Emory University, I'm sure you've had throughout this e-course example. There are also several trials happening at the moment, the links between WASH and NTDs. One example of that is a trial being undertaken by Queensland University in East Timor. We've seen a lot of dialogue happening at the global level. Notable examples you may have heard of are very round tables that have happened. For example, a round table of WASH and NTD actors in Seattle last year. There's been quite a lot of global conversation between WASH and NTD actors around the London Declaration on the Elimination of NTDs. It was agreed just 2 years ago. And we've also seen some sector-specific dialogue happening around disease communities within the NTD sector as a whole. So, for example, a lot of conversations between WASH and NTDs actors on the need to eliminate blinding trachoma, for example. We've seen joint advocacy happening example you can see on your screen is a briefing note issued by Site Savers and WaterAid earlier this year. Site Savers and WaterAid are organizations that have very different agendas and remits in terms of programming work. Site Savers obviously working on blindness and the prevention and treatment of blindness. WaterAid is very much a WASH NGO, but here in this example we came together around making the case for more integration around prevention and treatment of blinding for trachoma. We've also seen many more examples of programmatic collaboration, mainly around what NTDs organizations agreeing to collaborate in a specific geographic area on delivering NTD interventions alongside WASH interventions. For example, in Ethiopia, you've seen collaboration between WaterAid and Orbis on making sure that WaterAid is delivering water and sanitation services in areas that have high levels of trachoma infection. I think that here it's useful to try and separate the circumstantial, the coincidental elements from ones that would be done on purpose. The coincidence element. I've put a slide here, the issue of staff exchange. The last couple of years, we've seen quite a lot of movement of individuals from one sector to the other. So, for example, WaterAid has hired 2 different country representatives into our program work over the last couple of years, who are NTD professionals and come very much from a medical background. We've seen people who used to work in the water and sanitation sector working in NTD organizations or an NTD pension. And that naturally leads to is a shared understanding of the need to collaborate, an understanding of each other's sectors and jargon and technical terms, which are very conducive to collaborating. Having said that this is a coincidence, there's also an element of design in there. I think that there's increased recognition in both sectors that if we hire people who have a broader set of capacity than the technical capacity that we're using in our own sector, that has built the kind of relationships that Lisa briefly mentioned in her last slide. For example, on having a useful dialogue with the Ministry of Health or technical departments within the ministry. Any factors that have helped this collaboration happen by design? Aspects put into place from the perspective of each sector. NTD side, I think a lot of the examples on good integration that hear from us today, the general as well from other people working in these areas, has been around the elimination of trachoma. Why is that? Why is it that trachoma has been easier to collaborate on? One of the trachoma sector, or the trachoma community has, as opposed to other disease sectors within the NTD community, or strategy which in itself is integrated. If others have not heard of this strategy before, let's explain a little bit of the strategy. The trachoma is the strategy which informs the way in which trachoma programs are designed and funded, and it's comprised of 4 elements: safety, antibiotics, cleanliness, and environmental improvement, which is another way of saying sanitation. So to have such an existing framework, which in itself brings together elements from several sectors, it's easier for us to try and work together collaboratively. Everyone is being held to account against the same strategy. Element which I think has created a sense of urgency in trying to work better together across sectors is the fact that several NTDs have very fast approaching elimination targets. A particular country or a particular organization is aware that trauma needs to be eliminated by year 2020. Don't have much time in which to arrive at that target. That sort of urgency leads people to look for solutions for achieving results at a program level quicker. And one of the ways of doing that is reaching out to other actors that haven't worked with in the past, which I think is very important. And again, just casting your mind back to Lisa's slide on advocacy planning, that's very important is to map out opportunities and take advantage of those from an advocacy perspective. Sorry, can I just ask whoever doesn't have their microphone on mute, could you sit now, because I'm hearing myself twice and it makes it a bit difficult to speak. Thank you. So the elimination targets themselves have created more funding opportunities that themselves allow for a more integrated approach. So we're seeing several funders coming forward and willing to fund more integrated programming, which help this collaboration go forward. On the water aid side, I think it's been quite a big transition over the last couple of years in recognizing that as a WASH organization, we take a responsibility in simply implementing more taps and toilets. We understand that our work has a role to play in disease control, but the work that we do has a very important role to play in addressing stigma and discrimination, improving equity and inclusion around access to water and sanitation services. So, for example, thinking about NTDs that lead to disabilities, such as lymphatic filariasis, such as leprosy, and such as trachoma, delivery of equitable and inclusive WASH services have a very important role to play in making sure that people with disabilities are discriminated against. And finally, in terms of the collaboration that we've been able to reach, there's recognition by both sectors that we're both trying to reach and serve the same people, the same target groups. NTDs are diseases of poverty. They're diseases that affect mainly those who are poorest and most marginalized. Those same communities who usually do not have access to water and adequate sanitation. So actually, if we collaborate more, we're likely to reach better program results in the long run. You said that a lot has been happening, but most of us recognize that it's not necessarily enough. As we've got elimination targets, but we're not quite there yet. And reaching those targets and reaching increased access to water and sanitation as well will require a lot more effort to happen over the next few years. So change should look like. What is our advocacy agenda? What's our objective? Which, as Lisa said, needs to be our starting point for advocacy. Something that we might be interested in asking for is global frameworks, such as the SAFE strategy, that allow us to work better together. As I said, trachoma is the only NTD that has a strategy which is integrated. One type of change might be that we ask for a similar framework for the NTDs as well. That makes collaboration easy, and I'll come to that in the example that I'll go through in a minute. Is actually having platforms that bring together the various actors that work towards disease control and elimination. An example at a global level is the 2020, which is the WHO Alliance on Trachoma Elimination. which every year and includes governments of pandemic countries, the agencies that are supporting those efforts, and the NGOs that work in the sector. At the national level, a structure that might be more familiar to you if you've come across it before is national NTD task forces, which bring together several actors and allow for joint planning and financing. The effective programs. We want to be able to create programs that better integrate the different elements of disease control, but also, as I said briefly in the previous slide, an impact in terms of reducing stigma, reducing discrimination, and improving equity. So what policy and advocacy messages look like in terms of taking an advocacy strategy forward? What we might want to do in terms of convincing decision makers that better integration of Russian NTDs is a good idea, comparing or analyzing the economic benefits of integrating those different interventions together. Many in the countries in which we work already have disease control programs that usually address only one element of disease transmission cycle. One example that you can see in the picture on the left-hand side of your screen is a little picture from a deworming program. Deworming is a very important aspect in managing things with soil-transmitted helminths. However, taking a deworming tablet on a regular basis doesn't actually prevent the transmission of these diseases. Because that deworming takes place repeatedly, and even though drugs are usually donated by pharmaceutical companies, the delivery of those drugs is not without cost as well. So one element that might be quite persuasive to decision makers is asking whether or not integrating what promotion and infrastructure elements into this kind of program will actually result in more economic benefits, but also a better value for money of the approach as a whole. Another element which is also of interest to key decision makers in country, or up to the presidential and prime ministerial level, the educational level of the population. If that is a key element in disease control, we also can make several assumptions about how much increased coverage and access to water and sanitation alongside and control elements will pay dividends in terms of increasing school attendance and reducing the kind of cognitive impairments that we might see in children of a very young age that have been exposed to disease and to undernutrition as a result of lack of water and sanitation and hygiene. And thirdly, and you can see a picture on the center of your screen from a leprosy colony in Ethiopia. This is a community which is repeatedly excluded and marginalized, and that in itself creates a burden not just on that community itself, but overall for the authorities and for the community as a whole. When you have a large group of people who are marginalized and poor, that is a burden to the community as a whole, but also in terms of being able to achieve results on reducing poverty and inequity. So politicians and high-level decision makers being able to reduce poverty and inequality is something that they've committed to repeatedly in poverty reduction strategies at a national level and the Millennium Development Goals at a global level. So I've said quite a lot about the reasons why why were we working on this and what would change look like, but I want to move now into more specific examples of what would actually look like on the ground. Several times, the lessons that the work on trachoma is providing us with. When we've done analysis of where collaboration has worked well in bringing together WASH and NTD actors to tackle trachoma, we've crossed several elements that we can say are probably the key success factors for that level of good collaboration. Listed them for you at the top of the page, going through them quickly. One thing to keep in mind is that everyone coming to the table has come with a joint objective, so everyone is actually trained to do the same thing rather than expecting the collaboration to deliver on their specific agendas. The other was clearly defining roles and responsibilities and allocating those roles and responsibilities to the different agencies. Well, there is clarity. And as we know from our own experience in the WASH sector, better clarity on who does what reduces fragmentation and wasting, which is a situation that we come across repeatedly when it comes to collaborating between different actors. So having a collaboration platform, what I mean by that is an official institutionalized mechanism, such as a task force or a working group, that brings all actors together repeatedly, and that is an official process which is administered and used by the Ministry of Health or other decision makers. Fact was a strong coalition. A coalition requires that we have all the right actors have a role to play. Not having everyone around the table results in a weak coalition. And then leadership. So in case of trachoma, where we've seen good results in terms of integration, we've had strong leadership from the Ministry of Health and from the specific actors in the Ministry of Health who need to be involved, and that the ministry as a whole is prioritizing this issue. And for many of you, I mentioned the experience of working with the Ministry of Health. You have got experience of working with, which is the Environmental Health Department within the ministry, which is often understaffed, underfinanced, and underprioritized. Makes collaboration very, very difficult. In this case, and we'll come to some examples, is that where collaboration has worked is what the Ministry of Health itself has prioritized the control and elimination of NTDs as a priority issue. International trachoma collaboration, you can see how those success factors are applied in practice. I mentioned before, we have the SAFE strategy, which allows for a joint objective and a collaboration arrangement without requiring the different actors who are involved in the strategy to do their own remits. So collaborating on a SAFE strategy in a particular country can do that without having to change the essence of its programmatic work. All to do is plan with others where services will be delivered. Again, before the GET 2020, which is the WHO chaired dialogue platform, which is a global platform that allows this dialogue to happen between all the key actors. And in terms of coalition, something I mentioned before, but some of you may be familiar with it, is the International Coalition for against Trachoma, the International Contra Trachoma Coalition, or whichever way around you want to have the C and the T, which is a global platform for NGOs working on trachoma elimination. But more interesting for you is how these success factors actually play out at a country level. give you the example of a piece of collaboration that WaterAid has been involved with in Tanzania, which I hope will start generating some ideas in your mind, and hope we'll be able to discuss this at the end of the session. In February this year, Tanzania, the key program of the Ministry of Health, the Environmental Health Department of the Ministry of Health and Social Welfare in Tanzania, together for a 2-day dialogue, resulted in a 19-point action plan, which is currently being delivered by actors together. Part of coming together was to come to a joint understanding of what integration should look like, and kind of elements are keeping integration from happening at the moment around WASH and NTDs and Tanzania. This was to develop those program elements that help us align or deliver better results on NTDs and WASH, and to ensure that the right impact indicators for purposes of monitoring and evaluation are built into the plans and strategies of the Ministry of Health. And the purpose was to define roles and responsibilities and agree a way forward, which I said resulted in a very comprehensive action plan. The strategic objective, which was agreed by the actors, was to improve the health of poor communities through better WASH access. And the first indicator was to eliminate NTDs by the 2020 in the targeted districts, the ones that are endemic for NTDs. We can start seeing how the success factors that we identified a couple of slides ago are actually being put into practice, and they have a chance of actually making this collaboration work. And four, there's no point of coming together and collaborating on an issue without coming together around a joint objective. So in this particular case, the objective was to improve the health of poor communities through better WASH access, and to deliver a deworming program, and it was to increase the coverage of services. It was outcome-oriented objective of health. As I said, having a framework that defines roles and responsibilities is really crucial. And as I said before, this resulted in agreement for strategic partnership and the work plan to this work forward. Collaboration platform and coalition was absolutely crucial. Without having this platform in place in the first place, who would we be having this conversation with? Rather than speak to the 20 different agencies and organizations that work in Tanzania on NTD control and management, there was interest that they could go to have this dialogue. And that has been helped by the fact that Tanzania has got a national neglect tropical disease task force. And to answer Rudolph's question, EAD means Environmental Health Department, which is the department responsible for sanitation, sitting under the Ministry of Health and Social Welfare in Tanzania. This is it. In terms of leadership, the Ministry of Health was a managing seat. And I think something here which is very important to reflect upon, as I said, the Ministry of Health is not always the key institution that leads on water and sanitation. However, when it comes to joint planning, program financing around NTDs, the Ministry of Health is an absolutely crucial partner. However, it's only worked with the Environmental Health Department, which I said to you previously, especially in the case of Tanzania, is very under-resourced, unfinanced, and under-prioritized. It's likely that the collaboration would have worked very well. Something for us to keep in mind when we think about building relationship with the Ministry of Health, it's not just the ministry, but who is it within the ministry that that has power, there's control over resources, human and financial, and retake ownership of the change process that we're hoping to see. So in particular, collaboration with the NTD task force not only helped WaterAid build a better relationship with the ministry, but it helped increase the profile of the environmental health department itself within the ministry. There's a question here about initiatives in Bangladesh. Irfan, if you were able to hold on to that question until we reach the end of the presentation, there are only a couple of slides left, and we can discuss this issue. Thank you. So, to take us to what is probably the last slide of this presentation, the resources or takes us back to Lisa's first place about how we move forward on advocacy. So, defining the objective is the key thing we need to decide in the first place. Without knowing what it is that we want to get out of this collaboration, in terms of the concrete change agenda, can't really start to collaborate. So the thing that you might want to think about is, where is that change needed? Is it a change? We know that we have the right policies, the policies that are being implemented. So if the policy is in place but not being implemented, the objective around building a collaboration mechanism, is it creating the safe WASH programming within NTD program, or about starting a new program altogether? Identifying who to target with the advocacy. That the NTD task force is the address to turn to, but it be that they're completely on board with us, that they're also suffering from under-prioritization in terms of political will, in terms of financial resources. So it may be that we need to go a bit higher. It means that it's the higher level decision-making parts of the Ministry of Health, where it could be looking at even higher level politicians. Stakeholders and potential partners. There are many things for us to think about. In our sector, we're very used to having networks that collaborate on water and sanitation programming. It's very possible that networks like that exist on NTDs in the country. If work on NTDs is a health network that we should be trying to create an alliance with. Finding funding partners that are able to fund better integrated programs, or trying to increase the evidence base around this. So maybe a partnership with a university, either at a national level or at a local level, that will take this collaboration forward. There's a question there from Irfan, MOH, yes, MOH means the Ministry of Health. And what kind of messages do we need to choose in order to these people? Doing a report help, or trying to engage journalists and the media in terms of telling the story about the impact of those NTDs on poor and marginalized communities? That maybe create the bigger political pressure that we need in order to unlock areas that are holding us from being able to collaborate better across sectors. And then the last point, I think, has been made clear by Lisa and by me earlier on in this presentation about needing to find and map out the opportunities. I'm going to stop there, and before we move into questions and answers at the end, to put the question to you. Ask you if you can think about any examples of those elements from your own context. And isn't an existing example, can you think about ideas that you already have about how you might be able to take this agenda forward in your own country or in your own district? So, go on mute and hope that we get a bit of discussion going. Thank you. Put something into the chat box if you want to share an example or speak or anything at all. Don't be shy. See that Kelly and Stephanie have got us started with the question. So Kelly, could you clarify if that question is to Lisa and myself, or is it to the group as a whole?
Look towards you and Lisa. Edition out there. What are some of the first steps? Like if I knew that that the government in my country had policies, but they weren't yet implemented. Somebody who's working in the wash sector, what are some of the first steps that I could do to have these policies be implemented, or have other parties be more aware of collaboration?
Maybe I can make a start and then hand over to Lisa. The first thing to try and understand is why is that policy not being implemented? Most of the time when we say that a policy exists, if we actually look at the details, we can see that what's mentioned, probably in the preamble or the background to the policy, we'll dig down into the actual intervention and simply into the indicators that are included in the plan or strategy that follows on from the policy. Those don't include what interventions. When the interventions, which sometimes happens, and for that we'll need to dig deeper into the plans and strategies that are put in place to implement the policy. Sometimes we can see those interventions are in there, but they don't have clear lead from the Ministry of Health, or that have been funded. And there's a clear lead. Sometimes the funding for creating that kind of intervention has either not been allocated, or there's an expectation that someone else, someone is usually not defined, will come and do it. So, in terms of what NGOs can do, I think, is to first of all understand what is it that's good about the policy and isn't being implemented, and then make the decisions that follow on from that. So either we ask for the policy to be revised, or we say, here is the policy, it's not being implemented, and this is what we think needs to happen in order to implement it. Please want to carry on.
I think that covers. I would just add that once you identify what's not been implemented, that will oftentimes help you figure out who your allies are. Many times they're unexpected. Maybe it's another sector that's experienced the same barrier that you would never have imagined until you do analysis. But I would go back to our experience with reproductive health and the global funds. just as oftentimes good policies are not known by most people in the country where the policy exists. You know, a lot of collaboration with the NGOs, the partners that you think are the easiest to get on your side, to make sure that you have the same information to make sure that, as someone just typed in the box actually, that political is known where it exists, because it's important to praise the government that have established good policies and not only to criticize them for not implementing it. There's a lot of possible ways of looking at it, but I think ensuring that everyone starts with shared information is a good place to begin. There's a couple of great questions and comments coming in. Thank you very much. Yeah, do you want to respond to any immediately, or do you want me to begin?
Yes, let's do them by order. So, Karen, there's a question about NTDs and nutrition and wash. Let me maybe say a couple of things. I'm not sure I'm getting what the question is, but I think that there's a very strong case that you can make for linking the three elements that you're mentioning. And for the benefit of others, I think what Karen is highlighting here is exactly element 5 in the slide that you can see in front of you. Slide, she or he, sorry, I'm not sure whether I'm getting the gender right, has identified that nutrition is where politicians are putting their biggest priority and attention at the moment. So this is an opportunity to link our change agenda to change agenda of the government. In this particular case, I would highlight that there is very strong evidence that repeated word infections and repeated diarrhea lead to stunting and undernutrition, especially when they happen to children in the first 2 years of life. So when it comes to a government trying to put together a multi-sectoral nutrition action plan, which many of them are doing at the moment, they'll be informed that failing to integrate elements into that plan will result in less effective results. And therefore, any plan on nutrition will have to have wash access indicators, and those elements of wash access have to be fully costed as well. That would be the change agenda that I would probably take up with the government of Timor in this particular case. I don't know if you've got something to add.
That's really a really good place to begin. I do agree with the emphasis on space. It's very common that governments will be comfortable acting until they have had enough data to convince them. So it's an important point that's been raised. If the comment from Sandy and CRC, I don't know if there's anything specific that you would like us to respond to there, but I think you're absolutely right that is really it's difficult, and it does require a lot of advocacy. And I would go back to the points that were challenges that we were raising earlier, that the stakeholders like ourselves, the NGOs and the UN partners, we can be a very important example for the governments about how this collaboration can be done. And joint advocacy is extremely powerful in my experience.
Mm-hmm. Maybe just to add a small point on that, Sandy, I think that you're absolutely right, and this case of wanting to focus first on PD, which for the benefit of everyone is preventive chemotherapy, usually providing mass administration of either deworming tablets or antibiotics, depending on what the disease is. It's very hard for ministries of health not to do that because they have a very clear incentive to deliver those programs, and that's the fact that those drugs are donated. So it's a very cheap program for them to run. And by running a PCP program, they can tick the box and say, we're doing something on NTDs. So the kind of arguments that you need to employ in order to change their minds are more sophisticated. They're around the issue of sustainability. What will happen once the drugs aren't donated anymore? In terms of placing a price tag on the cost that the Ministry of Health has incurred by running a PCP program, as we said earlier, just as the drugs are donated doesn't mean that it doesn't cost the ministry money to distribute them. And also, their issue of advantage of the fact that a PCP program is being delivered to do other interventions that help reduce other diseases. So if we know that the PCP program is running in schools, students and pupils are being given drugs on a given day, this is a great opportunity and a low-cost opportunity, hygiene promotion at the same time, it prevent other illnesses such as diarrhea and pneumonia. So for you, and I'm sure that other countries feel the same way because they're facing exactly the same situation. On Irfan's point, I agree. There's political will and eagerness of government is absolutely important. And in Bangladesh, I think that what this is a very strong public health association, which is very on board with the integration agenda and have quite good influence over the Ministry of Health. So as Jean-Eugène is mentioning later on in the comments, as you can see, mapping the other stakeholders who will be able to influence the key decision makers together with you is absolutely critical. So into thinking about the kind of platforms that exist in Bangladesh, that would be one of the platforms that I would highlight. I'll hand over to Lisa for a second so I can read through the other questions. Lisa, comments on any of the other questions there? Okay, I'm not sure. Okay, I'll just keep going for a little bit. Sorry, just reading through last question about the MDA program for WAS and bilharzia, schistosomiasis. Okay. I think this is a really important point, Ralph. If I'm understanding what you're saying, you are describing a situation where the MDA program itself, MDA is mass drug administration for everybody, because the MDA program is being delivered in isolation, there isn't a very clear message going to the community on what this program is for and what else they can do in terms of protecting themselves and their children from disease. This is a really, really important point to make, and maybe I'll just give an example of something we're doing on the immunization side, which is making more or less the same point. And we're in the middle of setting up a pilot for integrating hygiene promotion into immunization against rotavirus, which, as you know, is a diarrheal disease. What we need to do there is incorporate hygiene promotion into the moment in which children are being given the vaccine. And the reason for that is that if people aren't informed about what this vaccine is for, not for, i.e. in this particular example, this vaccine protects against one type of diarrhea, but not all diarrhea. Parents who have vaccinated their children against this disease might think that the vaccine isn't working if the vaccine is for all diarrhea. So the point of doing hygiene promotion at the same time as vaccination is to not only do hygiene promotion, but to also improve the understanding that people have of what vaccine is for and the trust that they have in the immunization program. I think that in the case of Zimbabwe, there's a very strong case that you can make to the people who run the MDA program, that if we collaborated, people have a better understanding of what the MDA program is trying to do, and that will increase its effectiveness. Or mute. Sorry about that. Oh.
Sorry, says computer had a little bit of trouble. But thanks so much, Yael, for the great discussion and everyone's excellent questions. But we're coming close to the end, and I just want to introduce again Ogden to close up the course with some final comments. So thank you so much to both of our excellent presenters. And actually, if you could stick around for a few minutes, we answer any questions in the chat box if people have questions. But thanks again so much.
Sure.
And here's Stephanie.
Yeah, thank you both so much for a really wonderful presentation, and thank you all for the really rich discussion. And I think, as I said, Yael and Lisa, if you guys are willing to stay on for a few minutes, I'm conscious of people's time, knowing that everybody is at different points in their day, and so I want to make sure that we end by the 8:30 our time, 1:30 time that we said we would, but I would love to come back to a more discussion in a few minutes once we do just a very quick wrap up, if that's okay with you, Yael and Lisa. Thank you. So very quickly, so I'm again, to introduce myself again, I'm Stephanie Ogden. I'm the WASH NTD coordinator for the Task Force for Global Health, which is based in Atlanta in the U.S. I'm also the Senior Water Policy Advisor for CARE here in Atlanta. And I just want to bring us back to bring us full circle in the course, and spend just a few quick minutes looking over the landscape of what we've discussed throughout the course, and a short series of questions to ourselves to help us understand how, as WASH practitioners, this knowledge and understanding of WASH and NTDs can be carried into practice in our programs. So just looking back, and I really want to just spend a few, maybe 5 at the most 10 minutes here looking back and posing these questions to ourselves, and then kind of return to discussion if folks have time. So in the first module of the course, we look at the global significance of the neglected tropical diseases, and particularly those that are WASH-related. And just to that, 2 billion people are affected worldwide, so this is a problem of some significance, and though these don't cause mortality, they do cause very significant morbidity, which affects health and well-being, but also educational attainment and economic potential of the communities where the NTDs are endemic. We as WASH practitioners care about the NTDs. We discussed this quite a bit over the course of the modules. And back to the same points, which was that The WASH and NTD communities have overlapping target communities. We both target the poorest of the poor. We also have overlapping goals. We have some divergent goals, obviously. We all have overlapping goals, such as improved health, improved education, and again, improved economic potential. So working together towards those shared goals can have mutual benefit. As WASH practitioners and our WASH programs are already having an impact on the NTDs. So let's start to measure that. Can we use impact on the NTDs as an indicator of WASH program success? There appear to be ways in small revisions to WASH programming can have really great impact on the NTDs. And an example that comes to mind is incorporating face washing into hygiene education, which would have a great impact on trachoma, on the use of trachoma in communities where it's endemic. So our ways, and we've discussed a few in which we can modify our WASH programs only slightly or to more significant impact the NTDs. In most specifically at which WASH interventions had impact on the NTDs, specifically at the evidence base for this. And Dr. Freeman discussed the evidence base, and the overall message there is that there's much evidence of an association between WASH and impact on the NTDs. We know intuitively as well that this is the case. There's need for more rigorous evidence base, and that evidence is currently being collected. But that we do have suggests that WASH interventions do have a marked impact on several of the NTDs. He also explored the idea of which WASH interventions are important in combating the NTDs both individually and together. Our interventions such as face washing and incorporating, again, face washing into hygiene education, which can have an impact on a single disease like trachoma. There's WASH interventions that will impact on multiple NTDs in communities where multiple NTDs are present. And in many of the country contexts present here, that it is the case that communities have multiple NTDs are important. Out that evidence base and that research, what emerges again and again is the importance of sanitation, combating multiple NTDs. So elevating sanitation is an issue, and increasing investment in sanitation is a priority. We looked specifically at mapping and monitoring, and we asked ourselves the questions, how do we know where to target WASH for NTD control? How can we identify the communities where the high disease burden and low WASH coverage? We discussed some of the new mapping resources that are available for that. We provide a bunch of links in Rachel Pullen's presentation that you can go back to and visit. Those resources are freely available online. Consult them in your own country context. We asked ourselves the question, how do we measure progress? As an organization, how can we measure progress towards cutting the NTDs? What we discussed there was that the NTD sector is already measuring change in disease prevalence. National programs are already measuring disease in order to tackle 2020 targets for disease control and elimination. In many countries, the NTDs are an emergent priority, and there's increasing attention. So the WASH sector partner with ministries of health and NTD control organizations that are already measuring disease, partner there to help our own WASH programs measure impact and NTD control as an aspect of our program. In addition, we know WASH services can only impact NTDs in the long term if they are sustainable and functioning in the long term, if those services are sustainable. So post-implementation monitoring of WASH services is important, an important metric in NTD control. In this mod today, really, really excellent presentation. I think the concrete examples of collaboration at the policy and advocacy levels, which I think are ideas are often difficult to heads around and difficult to envision, particularly as as we our programs. I explored some questions today in a much more nuanced manner. First is the role of WASH practitioners as advocates, and Lisa's suggestion that we engage in advocacy whether we know it or not. So how effectively do so? How can we more effectively target our messages to certain audiences? How stakeholders the relevance of WASH for NTD control, including donors? How we is to advocate for increased investment in WASH additional to NTD control and wider health outcomes. We use collaboration with the NTD community as an opportunity to increase investment. So I want to come back to the objectives of the course and summarized here, say overall, the objectives of this course were to help us as WASH practitioners to understand, measure, and report impacts that the WASH sector is already having, form our WASH programs of interventions that are appropriate to the NTDs, identify NTD endemic communities that are in need of WASH, and improve the WASH, to engage in joint advocacy with the NTD sector and to learn how to do that, to elevate both WASH and NTD issues among important stakeholders, again, including donors, to raise awareness among donors of this issue. Coordinate messages for more effective health and hygiene behavior change. So I want to pose to us then these objectives. Did you achieve these objectives is likely? And what other information do you need in your own country context to fully achieve these objectives? I would come back as we pose to ourselves how we move this knowledge and learning into practice. I would pose to ourselves what is the additional information that each of us needs within our own country context to put this knowledge to practice, into practice. I briefly want to pose some potential next steps or pose the question of what are our potential next steps for each of us in our own country context. And I went back to the premise of this course, the underlying assumption, which is that collaboration between the WASH and NTD sectors is an opportunity for mutual benefit. And pose the question to you as participants here, and maybe leave you with the question, is how do you see collaboration as an opportunity for your program? Does this really seem like an opportunity that can benefit your WASH program and communities that you serve? In the question to ourselves again of what are the next steps in our own country context, which between the many practitioners participating in this course, I think there will be much overlap, but I don't think the next steps will be specific to your country context. So potential next steps. And I will send some of those next steps in general sense are seek additional country-specific information, seek maps that are available for your country context, which of the NTDs are present and where, and policies, what is the policy environment in your country context for WASH and NTDs in particular? What are the 20 targets countries? Then also to identify and talk to your NTD control partners. This begins with ministries of health who have set the national targets for NTDs, and the ministries of health NTD programs are often within maybe a program in and of itself, NTD control program or prevention program. May also be in the blindness prevention program in the case of trachoma, or preventive health in some country contexts. So look for those NTD partners and open up dialogue. Begin to see where your overlap is. And then finally, look at the areas where you're already working. So I know that many of you have programs across your country context. What geographic areas in which you're already working? Who are the partners you're already working with? are NTDs present in those communities and which ones, how their WASH programs be adapted to contribute to the NTDs. That is, do additional elements need to be added or additional emphasis need to be added to your program in order to contribute more concretely to the NTDs? Is there a role for collaboration, either at the district or the national level or even global level? Questions to all of us as we wrap up the course here. And I want to point to tell what's upcoming in our section of WASH and NTDs. Our group has been working on a series of manuals, WASH practitioners, encompassing much of the information included in this course in a short manual that is country specific. We hope to have these manuals by March of 2014. We'll always start to put them online as we have them, and Ethiopia will be the first country context that will be available by the end of the year. It will be at the site listed here, which is www.washntds.org. It is not up and running quite yet, but will be by the end of the year. So by end of December 2013, that site will be operational. There will be a few of the manuals uploaded with each of the country context to come by March of 2014. I want to end in thanking all of you for your participation in this course. Thank you for your contributions and your thoughts. Brought the richness to this course through your discussion and questions and through your own experiences in country, and we're anxious to share those among you. So I know we'll consolidate the comments and questions from today's session as well and disseminate those among you. We'd also like to share some of the examples that have come through in the assignment. So we'll consolidate and a few of those examples and pass those among you as well and make them available. Thank you again to Yael and Lisa for the fantastic presentation. Again, very, very concrete examples, and I think that they would be very excited to follow up if you have any questions. So for your participation, and I'm going to get back to Kelly.
Thanks, Nate, for that excellent presentation. It's been a wonderful course. I have had a lot of consistent questions and emails and feedback from people, positive feedback, and great assignments coming in. I look forward to seeing assignment 3 as all of the other to get done by Friday, December 13th. So again to everyone, and this recording will be available. Who came in late, those who had to leave early, the recording will be available at the end of today. So thanks so much, and we'll stay on for a little bit in case there are additional comments or questions.
Here, maybe just to say one quick thing, because I think the comments from Behanu about Ethiopia weren't responded to. You mentioned, Behanu, that the task forces are working to create integration, but there's not enough membership of WASH people in those task forces. I think that's absolutely right. The nice thing about Ethiopia is that there was an NTDs launched in the summer this year, which really lays the ground for better integration between the sectors. So I think it opens the door for more advocacy to happen. All we need to do now is push it further open so that we are part of the processes and the task forces that are being set up.